Ask you all to please take your seats. We're going to go ahead and get started. If I can ask our panelists to please come up to the stage and our speakers to please come up to the stage. Francesco and Rüdiger, do you want to come up and sit here first? Welcome, everyone. We're going to go ahead and get started. It's a lively group today. So welcome. Thank you, everyone, for joining us for this event, Using the Power of Taxes to Improve Health. We're pleased to be partnering with the World Health Organization on this event, which I hope will be a conversation with all of you about how we can be more effective advocates for fiscal policies to fight chronic disease and ensure better health for all. My name is Lucy Sullivan, and I lead the Global Health Advocacy Incubator, an organization that supports locally led advocacy to change policies and systems to improve health and save lives. Together with our parent organization, the Campaign for Tobacco-Free Kids, the Global Health Advocacy Incubators partners with civil society organizations in more than 40 countries on a range of issues, ranging from preventing diet-related chronic disease, to improving road safety, to saving children from drowning, and ensuring countries have the resources they need to prevent the next epidemic. Our model focuses on building the advocacy and technical capacity of civil society organizations to push for the passage of policies that can improve health at scale. And of course, excise taxes and other fiscal measures are a proven way to do just this. Our organization has particular expertise in developing winning advocacy campaigns to pass tobacco taxes and taxes on sugar-sweetened beverages and other ultra-processed foods. We have worked on health tax advocacy campaigns in dozens of low and middle-income countries and across different political contexts. And we work hand in hand with local advocates at country level to build comprehensive advocacy campaigns that focus on policymaker engagement, media advocacy, legal and legislative analysis, countering industry opposition, and employing litigation strategies when necessary to protect and strengthen health policies. The Global Health Advocacy Incubators' civil society partners have successfully championed the passage of taxes on sugary drinks in Nigeria, Colombia, Barbados, Pakistan, and most recently Ghana. And the evidence shows that when formulated correctly, excise taxes on health-harming products reduce the demand for these products and have the potential to reduce the burden on health systems from non-communicable diseases. In certain contexts, such as in the Philippines, which we will hear about today, excise taxes can raise revenue for important health programs. In his report to the member states yesterday, Dr. Tedros highlighted the importance of health taxes in the fight against non-communicable diseases and illustrated how WHO is providing critical technical assistance in this area. He noted that since 2017, 133 member states increased or introduced new health taxes on products that harm health, including tobacco and sugary drinks. The experts here today from WHO, government, and civil society come at this from different perspectives, but I think 3 points run through their messages. First, health taxes are a double win. They improve health by reducing the consumption of health-harming products, as they raise funds for governments, which in turn can be used to invest in public health. Second, advocacy is critical to build political will to implement health taxes, as well as to counter the influence of industries with a vested interest in disrupting or overturning, in some cases, policies. And third, lessons learned from effective policy adoption and implementation can be applied, that we've learned in one area, tobacco, alcohol, food, can be applied across other areas to reduce the impact of health-harming industries. So I hope you'll enjoy today's conversation and encourage you to be part of it here in the room, and those of you online. This event is being live streamed, so please use the hashtag Global Health Advocacy and hashtag WHA76. So now it's my distinct pleasure to introduce our first speaker, Dr. Rüdiger Krech. Dr. Krech is the director of the World Health Organization's Health Promotion Department, which works to reduce risks associated with tobacco use, alcohol consumption, and physical inactivity to contribute to better population health. The floor is yours.
Thank you very much, and a very warm welcome, a very warm and good afternoon to all of you. And I'm really happy to see a full house here because health taxes is an important instrument to actually create healthier populations. So let me just echo Dr. Sullivan's welcome to all of you to this session on using the power of health taxes to fight non-communicable diseases. Health taxes are taxes imposed on products such as tobacco, alcohol, sugar-sweetened beverages that have a negative impact on health. These taxes have proven to be cost-effective tools in reducing the consumption of health-harming products deemed as major health risk factors for NCDs, which are the leading causes of death globally, and NCDs such as cardiovascular diseases, cancers, and diabetes impose a significant financial burden on our healthcare systems. This can be significantly challenging in achieving our ambitions for universal health coverage. Allow me to emphasize 3 important points about health taxes from a public health perspective, from a finance perspective, and from an equity perspective. First, from a public health perspective. Health taxes influence consumption behavior as it usually leads to price increases of these products, thus making them less affordable, particularly to some lower income groups. These taxes save lives and are highly cost-effective policy tools for averting millions of deaths associated with consuming these unhealthy products. Health taxes are most effective when implemented as part of a comprehensive package of reforms. In the case of tobacco control, while raising tobacco taxes is the single most effective control measure, it still works best when applied as part of the Empower package of demand reduction measures. And so therefore, it's important to also give people assistance when they want to quit smoking. You need to regulate where you can buy those products. You need to measure to see what progress you're making. And of course, then you need to raise the taxes as well. So it is always a package that we apply in tobacco control and alcohol control as well. And that is important also to see the effectiveness of this one tool within this overall framework. For example, and we're going to hear from Senator Pilar in a second, in the Philippines, the implementation of tier simplification and large tax increases alongside other tobacco control measures significantly reduced tobacco use prevalence amongst adults from 29.7% in 2009 to 19.5% in 2021, representing a relative decline of 34.4%. Second, from a finance perspective, health taxes are one of the 3 broad instruments of fiscal measures for health. The other 2 are subsidies and investments. And I believe we need to look at health taxes also in the context of the other instruments that we have within the ministries of finance to actually design healthier societies. And just to give you one example, we need to much more work with governments also on their subsidies. Can you imagine that the world still subsidizes fossil fuels with $5 trillion US? $5 trillion US, that's almost as much as we spend on global health. Right? So just for fossil fuels, where we know that this is the wrong direction. So we can actually think of these three instruments of taxes, subsidies, and investments in balancing and finding ways that make people healthier and making healthier choices more easy. So therefore, these measures are all under the control of fiscal authorities, but can potentially shape the environment to make healthier choices easier. These taxes can also be revenue boosters in today's tight fiscal environment of budget deficits and increasing debt burdens. And third, from an equity perspective, health taxes support inclusive growth and better equity. They do not harm growth and promote health equity as chronic diseases resulting from consuming tobacco, alcohol, and SSBs hurt the poor more than the rich. People of lower socioeconomic status have a higher risk of NCDs, as they tend to consume more of these harmful products. When they get sick, the impact is more burdensome, even catastrophic. Health taxes can therefore be a powerful tool to correct the highly inequitable distribution of death and income losses, thereby reducing catastrophic healthcare costs. Evidence indicates that when faced with increases in health taxes, individuals from low-income populations tend to reduce their consumption of taxed products more compared to higher-income individuals. Many studies, including those conducted by the World Bank, have shown that these disproportionate reduction in consumption of harmful products also results in reduced incidence of related diseases and in associated healthcare costs, and increased productivity due to improved health outcomes. Thus, when analyzing comprehensively the effects of health taxes, it is evident that low-income populations benefit the most. In conclusion, health taxes are a win-win-win. They are a win for public health, they are a win for revenues, and they are a win for equity. However, implementing them is easier said than done. Powerful industry and vested interests oppose raising these taxes. And again, we're going to hear from a country how this is done and how the tactics of the tobacco, for instance, or sugar industries counteract those efforts in getting the things right. That is why political will at the highest level, backed by a broad coalition of reform, including civil society, and that's why I'm so grateful to have you all here in this room, is needed to counter these vested interests. It is fair to say that among many countries, Colombia and the Philippines stand out as a testament to the effectiveness of health taxes in improving public health, reducing healthcare costs, mobilizing revenue, and addressing health inequities. My colleagues, I trust your learnings and insights from today's session will further strengthen your resolve to advocate for health taxes reforms in your respective countries, and I thank you.
Thank you, Dr. Krech. I'm not a doctor, but I do play one on TV, so thank you for that. Now we will actually hear from a real doctor, Dr. Francesco Branca, who is the director of the Department of Nutrition and Food Safety at the World Health Organization. Prior to that, he was the director of the Department of Nutrition for Health and Development. And during this period, under his leadership, WHO developed a WHO nutrition strategy and developed a new nutrition guideline process. He has been a senior scientist at the Italian Food and Nutrition Research Institute, the president of the Federation of the European Nutrition Societies, and on the medical staff of a primary healthcare project in Somalia. Dr. Branca, the floor is yours.
Thank you, Lucy. I mean, I try to say, don't read everything, but she just doesn't listen. Now, I really would like to thank, good afternoon, colleagues. I'd like to thank the Global Health Advocacy Incubator for organizing this event. And thank you, Lucy, particularly for your continued leadership on public health changes. And I must say, I really would like to acknowledge she has a role in the global acceptance of the global nutrition targets. I'm always indebted to her for that. So as we heard, health taxes are a viable solution to prevent non-communicable diseases. Taxes on tobacco, alcohol, and on food and beverages that do not contribute to a healthy diet. An unhealthy diet is a scourge. It leads to an estimated 8 million deaths. In addition, obesity accounts for additional 5 million deaths every year, and maternal and child malnutrition to another 3 million deaths. Altogether, diet and nutrition account for almost 1/3 of all deaths. And let's not talk about the disability-adjusted life years. Even long lives without health are not worth living. The cost of obesity and obesity-related diseases continues to rise, reaching $1 trillion every year, which accounts for over 13% of all healthcare expenditure. And if no further action is taken by 2060, the economic impact from overweight and obesity is projected to rise to over 3% of global GDP. So healthy diets, in addition, are unaffordable for almost 3 billion people. And at the same time, unhealthier options such as sugar-sweetened beverages are largely affordable and in reach of most population, even in the most remote areas of the world, as you know. Price interventions such as taxes and subsidies on foods and beverages are key actions as part of a comprehensive package of policy options to prevent and control obesity and diet-related non-communicable diseases. WHO has developed guidance to contribute to food system transformation, including on school food and nutrition policies, nutrition labeling policies, policies to restrict food marketing, and on fiscal policies to promote a healthy diet. So we have a full package. It's going to be discussed hopefully tomorrow afternoon and endorsed hopefully by the World Health Assembly as part of the non-communicable disease package of best advice. For fiscal policy guidelines, most recent evidence was reviewed on the impact of food and beverage taxes and subsidies on both immediate outcomes, such as changes in price, purchases, and consumption, as well as longer-term outcomes, such as body weight and diet-related non-communicable diseases. Based on the reviewed evidence, we have formulated 3 recommendations. Number 1, a strong recommendation to tax sugar-sweetened beverages. Number 2, a conditional recommendation to tax foods that do not contribute to a healthy diet. And number 3, a conditional recommendation to subsidize foods that contribute to a healthy diet. Now, conditional implies an analysis of national context to make a decision to adopt the policy, and we can discuss that later. Evidence on the impact of taxation of sugar-sweetened beverages comes from studies assessing 25 national and subnational policies found to have a large effect on price change and purchases, and there's more, unfortunately not as well evaluated. Evidence on longer-term outcome is lower, but promising. A recent evaluation of the national SSB tax in Mexico included BMI percentile as an outcome and showed a 3% decrease in overweight and obesity prevalence among adolescent girls following the implementation of the tax. Another study in England tracked changes in the levels of obesity between 2014 and 2020 among children from school entry to year 6 following the implementation of the sugar levy. And the study demonstrated an 8% relative reduction in obesity levels in 10, 11-year-old girls. And reduction was greatest in girls whose school was in the most deprived areas. That's incredibly important news. The evidence of food taxes is limited because not many countries have implemented them as public health measures. The WHO guideline was informed by the experience of Denmark, Finland, Hungary, and Mexico, and by the taxes established at subnational level in the United States of America. Taxes on sugar-sweetened beverages, on food products, or subsidies on foods are not a silver bullet, but are an important, and I would say an absolutely critical part of the technical package to prevent and manage obesity over the life course. The 75th World Health Assembly last year endorsed an acceleration plan to stop obesity, an initiative of the World Health Organization in collaboration with partners such as UNICEF and World Obesity to support member states in implementing cost-effective recommendations based on individual country needs and priorities. Until now, 28 frontrunner countries have come forward to accelerate action towards tackling the obesity epidemic. The implementation of taxation of sugar-sweetened beverages is one of the interventions that countries have selected most often. So at least 10 countries are ready to go on that. And they have really seen this as a priority as part of their roadmap. WHO, together with its partners, including civil society, will continue to support countries in implementing the taxation of sugar-sweetened beverages. It's a joint effort of our nutrition, food safety, and health promotion teams, and other fiscal measures to promote healthy diets and prevent and control diet-related non-communicable diseases. We really much appreciate the collaboration with the Global Health Advocacy Incubator as an important leader for that advocacy, as well as that of other organizations such as the World Bank or the International Monetary Fund, who are really taking this as a key measure for improvement of public health. So thank you for your attention today.
Thank you. Thank you, Francesco. So WHO's leadership on this is absolutely invaluable, but we know that these taxes wouldn't see the light of day if not for political courage and perseverance and strategic advocacy, which is why I'm so excited that we have these two incredible panelists today joining us. We are really lucky, all of us in this room, to have Senator Pia Cayetano join us from the Philippines. She has a track record for winning the toughest fights. For nearly 2 decades, she's led the passage of landmark laws on healthcare, education, and measures to support economic growth. And she is a staunch health advocate. She worked for the enactment of the sin tax reform law to raise additional revenues for healthcare while curbing harmful vices, especially among youth. She chairs the Senate Committee on Sustainable Development Goals, Innovation, and Futures Thinking in the 19th Congress. Senator Pia also chairs the Asia and Pacific Regional Chapter of UNITE, a global network of parliamentarians committed to ending infectious disease. She's an attorney, economist, triathlete, and mother. So, Senator, over to you. And you can present here if you're more comfortable from seated. Perfect, please do.
Hello and good afternoon to everyone. It is my pleasure to share the Philippine story on the fight against tobacco. I could stand here all day. I promise you, I'm usually very worried that people will fall asleep, but with this story, I could stand here for 3 hours and you would not fall asleep. So the challenge will really be on how I can present this to you in a few minutes. I'm going to try to go chronologically just so that you have an understanding of the amount of time that has passed from the time I started working on this till today. But bear with me as I insert certain aspects of the journey as I feel it's relevant despite it being out of the timeline that I'm presenting. So I became a senator in 2004, and my seatmate was the former Secretary of Health who launched this campaign called Yosi Kadire. It means smoking is disgusting. So he was my seatmate and mentor. He was a doctor, and he told me to chair the Committee on Health and that he would guide me, and he truly was a good mentor for many years. So sometime in 2008 was my first start with tobacco control, and that is when I filed the bill on graphic health warning. And so the first lesson of this measure was perseverance, because it passed 6 years later, and I do have photos, which I hope will be shown in a bit. You'll see the pictures of the kids who were part of the advocacy group that were rallying for graphic warnings, and you'll see that from kids they became teenagers over the 6 years that passed. But we did pass that law. And that was in 2008. And then in 2008, and then it passed in 2014. But in 2009, I passed another measure, which was strengthening our FDA. And the goal here was to cover all products that affect health. That is the definition of the jurisdiction of FDA, all products that affect health. But then the tobacco group filed a case restraining FDA to act to control them, because they said that they're not covered by FDA. They are not a product that affects health. So let's digest that for a moment. Tobacco products do not affect health. Therefore, they're not covered by FDA. So that was their argument. Let me just leave you with that. So that's how it was for the next decade or so. That case was pending in the Supreme Court. And I filed as a petitioner, as an intervener, because that was my law, so I had standing to file as an intervener in that case. And then in 2012, this was my first sin tax law. And a little bit of history, the chairman of the Committee of Ways and Means, the Taxation Committee, filed a committee report with an extremely watered down tax provisions, very watered down. And this was just at the beginning of the Twitter age. So there was still not really a very strong social media presence. But the advocacy groups, the NGOs were very strong, and they actually got this chairman to resign. He resigned, and our Senate President had previously, I think, chaired the Committee on Ways and Means or Committee on Finance, but he ended up handling this putting forward a new committee report that had stronger taxation measures, and he asked me to participate by way of the health measures within the tax measure. So that was my first experience with sin tax in 2012. And this sin tax law, I'm happy to report, currently in the last collection in 2022, $2 billion is what we are collecting from sin tax, $2 billion. And this goes directly towards our universal health care and also health facilities. And I don't have time, but if anyone's interested, I can tell you all the health work that we have been able to do with this kind of funding. Our universal health care coverage used to be almost nothing, and now as a public servant, it's very rewarding. I get messages, I bump into people who say that their mother, their father, their grandfather, their brother has been able to have some kind of health care. It's not perfect, it's far from perfect, but we've come a long way. So that was 2012. In 2020, we then decided to put forward a new tax measure, and this time I was the chairman of the Committee on Ways and Means. And so we had a debate if we will ban or if we will tax the new products, which are the e-cigarettes, the vapes, and the heated tobacco. And it was decided that we will tax. Of course, technically, not really my boss, but of course the Department of Finance would rather tax than to ban. And considering that we are a country of 7,000 islands, there is always a lot of contrabands coming in and out, so the decision was to tax. So we taxed. And at that time, my brother was the Speaker of the House of Representatives. I was a senator. And with his support, we were able to come up with very good tax rates and 3 important health provisions to protect particularly the youth against the ills of this sin product. So we made the age of access to vapes and e-cigs to 21 years of age. We put the FDA put tobacco under the jurisdiction of FDA, and we said no flavors except original and menthol. And this passed. It's the first time that such a strong tobacco measure passed in Congress, and especially in the House, and that was because, with all due respect, I'm biased, of course, he's my brother, but it would not have happened if there was not a Speaker of the House who would let it happen. side story, the members of the House in the bicameral would be calling and saying, "You're in the Philippines, the term of endearment for older sister is ate," and they're like, "Your ate is giving us a hard time." But he told them that you need to do what is right. We need to look parents in the eyes and tell them we did what was right for your children. So we taxed them and we put these protective measures. So that was 2020. Barely a year later, my brother was no longer Speaker of the House, and they filed a new bill reversing all of these gains. And this is one of the most difficult times of my career because I was the sole oppositor in the Senate. I did have a few colleagues who fought with me on a couple of issues. I have to acknowledge that. But in the end, I was fighting on my own on this measure to ensure that we retain the 21-year age, the age of access, the flavor, the limitation of flavor in the jurisdiction. I lost on all. So we now have a law that lowered it to the age of 18. There's a new provision there that says, that basically allows all flavors, although there's a catch-all that says it should not be attractive to children. So no cartoon characters, no reference to ice cream flavor, something like that. But otherwise, it's still open-ended compared to what it was. Okay, some good news. Around this time, the Supreme Court finally made a decision that the jurisdiction of the FDA includes tobacco. So that was a win after 10 years. And as we speak, a motion for reconsideration is ongoing in the Supreme Court because, of course, the tobacco lobby will keep on fighting to remove their jurisdiction. But that is where we are today, and I continue to fight for this because the jurisdiction is now with the Department of Trade, and I have no idea how the Department of Trade is supposed to ensure the health of people, but I am thankful that at least I am seeing them working with our Department of Health and our FDA. So a few months ago, I filed a resolution, had a hearing on the proliferation of vape products that were attractive to children. They were literally cartoon packaging, very colorful ice cream flavors as are not allowed, and the DTI did work on seizing these products. So I want to be hopeful. I hope that we can continue to do the work we're doing. I thank you for this opportunity to be at this forum and to share the experiences we've had, because I do believe that with perseverance, if we keep on fighting, the day will come that we will be able to have a more secure place for children and to be able to use the power of taxation for good, which it has done. But when I was asked earlier, is it enough? I said, well, not if we don't put regulatory measures to also ensure limited use, especially for children. So I will leave it at that for now and open to questions later. Thank you.
Thank you, Senator. We're gonna come back to the Philippines and hear more about your journey and some of the challenges you face and lessons learned for other countries who are looking to do this. But first, we're gonna go to Colombia, which is an example of an incredible success story. And for that, we have Andrea Rodríguez with FIAN FIAN Colombia, which is a civil society organization that advocates for the right to food and nutrition. And in her role with FIAN, she coordinates advocacy on a range of food and nutrition policies, including front-of-pack warning labels, taxation on sugar-sweetened beverages and ultra-processed products, and the regulation of these ultra-processed products in school food environments. Andrea is going to speak in Spanish, and we will have translation simultaneously, or almost simultaneously, concurrently.
Muy buenas tardes para todos y todas. Es un gusto estar hoy en este importante espacio. Gracias, Lucy, a todo el Advocacy Incubator por la invitación y a las personas también que nos acompañan en el panel.
Good day to all. It's a pleasure for me to be here amongst you. First of all, thank you, Lucy. Thank you very much. And thank Global Health Advocacy Incubator for the invitation to this important event.
Efectivamente, Lucy, como lo has dicho, la sociedad civil en Colombia logró la aprobación de 2 impuestos. El primero a las bebidas ultraprocesadas azucaradas y el segundo a los comestibles ultraprocesados.
Indeed, Lucy, as you said, in Colombia, civil society succeeded in getting 2 taxes approved. The first to ultra-processed sugar beverages and the second to ultra-processed eatables.
Los 2 impuestos son progresivos a una tasa del 20% en el año 2025, con un punto de partida desde el año 2023 hasta el año 2025.
Both are progressive at a rate of 20% in the year 2025 with a starting point of the year 2023 to the year 2025.
El primero es un impuesto de tipo específico que se impone a las bebidas azucaradas de acuerdo a su contenido en gramos de azúcar por cada 100 mililitros.
The first is a specific tax imposed on sugar-sweetened beverages according to their content in grams of sugar per 100 milliliters.
Y el segundo es un impuesto ad valorem que se impone por cada 100 gramos a todos los productos comestibles ultraprocesados.
And the second is an ad valorem tax imposed per 100 grams on all ultra-processed food products.
Y algo muy importante, este último impuesto a los productos comestibles ultraprocesados toma como referencia los valores de los nutrientes críticos establecidos en la ley de etiquetado aprobado en Colombia en el año 2021, que toma en cuenta el perfil de nutrientes de la OPS.
And something very important to mention is that these are take into consideration the critical nutrients established in the nutritional labeling law tested in Colombia in 2021, which are those approved by the PAHO nutrient profile.
Ley que también fue una conquista de la sociedad civil, la ley de etiquetado nutricional.
This law was also achieved thanks to the work of the civil society. This is a labeling law.
Algo también muy importante que queremos compartirles es que logramos posicionar el concepto de ultraprocesamiento en la agenda pública nacional.
Another important thing that we wish to share with you is that we were able to position the concept of ultra-processing in the national public agenda.
Pudimos incluir en la ley de reforma tributaria de nuestro país la definición de ultraprocesamiento y esta va más allá del nutriente crítico. Se concentra en el conjunto del ultraprocesamiento.
We were able to include in the tax reform law of our country a definition of ultra-processing that goes beyond the critical nutrient and focuses on ultra-processing as a whole.
Y esto ha sido muy importante porque ha llevado a que, por ejemplo, tomadores de decisión, medios de comunicación, hablen de ultraprocesados, hablen del ultraprocesamiento y hagan una distinción entre estos y los alimentos.
And this has been very important since now the media and the decision makers are talking about ultra-processed and not food only when referring to ultra-processed edible products.
Y consideramos que este es un cambio también muy importante en nuestro país frente a las narrativas alrededor de lo que es un alimento y lo que es un producto comestible o bebible ultraprocesado.
And we believe that this is a very important change in our country regarding the narrative of what it's an eatable product or an ultra-processed product.
Estas conquistas en Colombia han sido posibles gracias a la creación de alianzas, a la creación de coaliciones desde la sociedad civil.
These achievements in Colombia have been possible thanks to the creation of alliances and coalitions from civil society.
Coaliciones que han llevado durante años un trabajo arduo de incidencia política y que son organizaciones que comparten y se fortalecen a partir de sus propias habilidades y experticias, y lo que ha llevado a unirnos en función de lograr estos impuestos.
Coalitions that have been doing these are coalitions that have been doing hard advocacy work for several years with organizations that complement and strengthen each other based on their skills and expertise, which has allowed us to join forces in various ways.
Esto nos ha permitido sumar esfuerzos en varios sentidos. Primero, asesorando a tomadores de decisión en los niveles legislativo y del gobierno y sus equipos de trabajo.
This, as I mentioned before, has allowed us to join forces in several ways, the first of which is advise decision makers at a legislative and governmental levels and their technical work teams.
Segundo, lograr fuertes lazos de trabajo con la academia libre de conflictos de interés, contando con expertos y expertas que nos apoyaron en el diseño técnico de los impuestos basados en la evidencia científica.
The second is we've achieved strong working ties with the academia free of conflict of interest, with experts who supported the technical design of taxes based on scientific evidence.
Tercero, generar movilización de la opinión pública, organizaciones sociales, comunidades, líderes y lideresas, medios de comunicación en función de defender y exigir la necesidad de los impuestos saludables en Colombia.
Number three, we've generated mobilization of public opinion, social and community organizations, leaders, and the media in order to advocate and demand the need for healthy taxes in the country, thus amplifying the voices and building consensus in the social basis.
Y logramos además nuestra participación como organizaciones de la sociedad civil en espacios de debate público y toma de decisión frente a la aprobación de los impuestos saludables.
We also achieved our participation in the spaces of public debate and decision-making regarding the approval of health taxes.
Estos triunfos no han sido fáciles de alcanzar. Tuvieron que pasar alrededor de 7 años y 3 intentos para que en el marco de las reformas tributarias de los años 2016, 2019 y 2021 se lograra la aprobación de los impuestos saludables, algo que finalmente conquistamos en el año 2022.
But these triumphs have not been easy to achieve. It took 7 years and 3 attempts to achieve them within the framework of the tax reforms in the years 2016, 2019, and 2021. The approval of health taxes, this was something that was finally achieved in 2022.
Tuvimos una fuerte oposición de la industria de ultraprocesados, medios de comunicación y gremios, así como de opositores en el gobierno y en el Congreso, así como la perjudicial acción de lobby de las grandes industrias.
We had a strong opposition from the ultra-processed food industry, the media, and even unions, as well as opposition from the government and Congress. We also had a damaging action on behalf of the lobbyists of large industries.
Esto hizo que en ocasiones, por ejemplo, estos actores generaran pánico económico al decir que las industrias saldrían del país si se aprobaban los impuestos saludables, todo con el fin de deslegitimar y atacar la sociedad civil.
This meant at times, for example, that these actors generated economic panic by saying that the industries would leave the country if the health taxes were approved, all with the purpose of delegitimizing and attacking civil society.
Para terminar, como sociedad civil en Colombia tenemos unos grandes desafíos. El primero es acompañar el proceso de implementación y monitoreo de nuestros impuestos, protegerlos y mejorarlos, dado que atravesamos por 3 demandas en contra de nuestros impuestos, instauradas en la Corte Constitucional en Colombia.
Now in Colombia, as a civil society, we have 3 great challenges ahead of us. The first one is to accompany the process of implementation and monitoring of our taxes and protect and improve them, given that we are going through 3 lawsuits against them that were so far unsuccessful in the constitutional courts.
Lo segundo es continuar con la vigilancia que desde la sociedad civil hacemos a los recursos públicos por parte de los gobiernos. Es decir, es muy importante saber en qué se invierten estos recursos que se recaudan con los impuestos Tenemos que lograr que sean invertidos en mejorar la calidad de vida de las personas, mayores inversiones en sistema de suministro de agua, fortalecer la producción local de alimentos y avanzar en mejores condiciones de salud.
Number 2 is to continue with the surveillance that, from the civil society point of view, we do to the use of public resources by the government. In other words, it is very important to know how these resources are collected through our taxes and where they are invested. We also have to ensure that these resources are invested to improve people's quality of life, greater investment in drinking water supply systems, strengthen local food production, and make progress in improving people's health conditions.
Además, es muy importante lograr que no se desvíen, que no se pierdan estos recursos, algo que pasa mucho en países como el nuestro, como Colombia, y por esto es fundamental la sostenibilidad de la medida.
Moreover, it is important to ensure that these resources are not diverted or lost, which is something that unfortunately happens a lot in countries such as mine, Colombia, which is fundamental for the sustainability of this measure.
Por último, y algo que es muy importante para nosotros como sociedad civil en Colombia, y es lograr que se fortalezcan las economías campesinas, la producción de alimentos reales provenientes de la agricultura familiar, comunitaria, étnica y popular, y mantener también nuestra incidencia como organizaciones de la sociedad civil en la garantía del derecho humano a la alimentación y nutrición adecuadas y en la soberanía alimentaria, especialmente en los niños, niñas y adolescentes. Muchísimas gracias.
Lastly, we need to continue working to ensure that in Colombia, we need to strengthen, above all, something that is very important for us, which is peasant economies, the production of real food from family, community, ethnic, and popular agriculture, to maintain our advocacy organizations so that Colombia can become more equitable and a sustainable country, above all, guaranteeing the human right to food, the right to food sovereignties, and food sovereignty, especially in the case of children. Thank you very much for your attention.
Gracias, Andrea. So we just heard two amazing stories of success and perseverance, although the battle is far from over. Of course, as you heard, Colombia being one of the first countries in the world to tax ultra-processed products in totality. I was struck by two things in each of the stories. The fierce industry opposition that you continue to encounter, both in the Philippines and Colombia, and the importance of public support for these measures. So I want to talk about something that you both mentioned and that was mentioned by our WHO colleagues around the earmarking of revenue for health promotion. And would love to hear a little bit more from all our panelists regarding this, especially in the context of the updated WHO guidance on fiscal policies.
Yeah, thank you. So first of all, earmarking in fiscal policies is usually discouraged, right? So because it actually increases the sort of complexity of actually then how this is administered. On the other hand, we know that there's a lot of public support to health taxes if that is accompanied with a broader campaign on explaining why one would actually increase those taxes and for what that additional money would be used. So we have a sort of discrepancy here. In addition, what we know is also once this is targeted for, let's say, health promotion or an institution for health promotion, one needs to also ensure that should a government change, like in Pia's example, and they would withdraw those taxes, what then would happen to those institutions that have been supported with those additional taxes? So it is a bit more complex, and one needs to find a balance for this. But in general terms, I think it's really important for us to also recognize that the public understands very well why certain taxes have to be increased. They do understand also the policies of subsidies, and you can imagine that sometimes when there's unhealthy subsidies, there's also a lot of discouragement from the public for those subsidies at the same time. So I think we have the public on our side if we do it well, right? So therefore, let's find a good balance between earmarking and letting this go into the general households.
Very good. Any other comments? Go ahead.
I just would like to add, reiterating what Rüdiger is saying, really this is important for people to accept the taxes. I mean, many countries there's a big debates about taxes yes, taxes not, but this earmarking of course helps. And we have some very good examples for this. And we have the example in Hungary where they taxed foods, and the revenue is used to increase the salary of healthcare workers, which is another sore point. UK is being used for school breakfast club. Mexico to bring water in water fountains in schools, although I'm not sure how that's been implemented. But Barbados to support other health initiatives. So I mean, it's actually a wonderful win-win. And I know that the finance people are not super happy about that for the reason that Rüdiger explained. But some of the health foundations, like the Thai Health Foundation, for example, have actually been able to produce a lot of good leadership because of that driving. Where's the money if we want to implement public health policies? So this is a important source. Thanks.
I want to talk a little bit about sort of the lessons learned in both the Philippines and Colombia. You shared, Senator and Andrea, a little bit about that. But if you were to give advice to other countries that are looking to implement taxes on tobacco, on ultra-processed products, what would you highlight as a key lesson and something for advocates, policymakers, leaders to take into account?
Well, let me ask a question. Is there anyone here who is a parliamentarian or works for a parliamentarian? So that's my first advice. So as you know, I am a member of parliament, and the work I've done is through parliament. And if we're talking about taxation, you need a parliamentarian to do that. Of course, I could never have done it alone. As I said, the Department of Finance worked very closely with me because their goal is to raise taxes. But in my case, because I had come from a background of 10 years as a Committee of Health chairman, so my inclination, my heart is really for what I can do to make the health system in my country better. So I think I was in a really good position to merge the two. Like I kept pushing for higher tax. I actually pushed for taxes higher than the Department of Finance was pushing for. So they were like, oh, sure, go ahead. But yeah, and as was mentioned, I am a member of UNITE, the chapter chair of Asia Pacific, and we're a network of parliamentarians all over the world for global health. And so this is exactly the work that I'm trying to espouse outside of my country, because it has not been easy. It is not easy, and it will not get any easier. It may get a little bit easier because the question earlier was like, how do you justify the earmarking? And when people know, and I have adult daughters, when they were in college and they now just graduated from college, they would say, good job, great. It's so nice to know that these public hospitals are now available. But you need that kind of feedback to do the work that we do, and we need better communication so people understand that this person pushing for tax has a bigger picture in mind. So working with the parliamentarians, the whole network of supporters, it is really important.
So parliamentarians, critical. Andrea, can you talk a little bit about civil society and lessons learned that you can share with other countries, with other colleagues in other countries?
Bueno, yo creo que para nosotros ha sido fundamental, como lo expresaba, el trabajo en coaliciones, el trabajo en alianza como organizaciones que tenemos un objetivo común. Eso ha sido fundamental.
I think that something key has been to work with organizations or alliances who share the same goals as us.
Lo segundo es también rodearnos de la academia. pero de una academia libre de conflictos de interés que sea la base de nuestras discusiones con los tomadores de decisión, que sea la...
Secondly, I think it's very important to work with the academic sector, but with an academic sector that is free from conflicts of interest and who can be the basis for our research and discussions with policymakers.
También sentimos que es necesario lograr la movilización social. Es necesario que las comunidades en los territorios se apropien de estas medidas para que sean ellas mismas las que las defiendan.
We also think that social mobilization is very important because it's the communities and society that have to make these topics their topics, and they are the ones who need to promote this as well.
Y dos cosas finales. Por último, que es muy importante para nosotros, o lo ha sido, lograr contrarrestar la interferencia de la industria y la captura corporativa. O sea, nosotros como organizaciones de la sociedad civil hemos tenido una batalla frontal contra las industrias de comestibles y bebibles ultraprocesados porque ellas han sido las que finalmente han incidido en la agenda de política pública y no han permitido que las medidas de salud pública que defendemos pues sean aprobadas.
And two final thoughts. First of all, we had a lot of resistance from the industry, so this is something that we have been struggling with because they have been interfering in the public health agenda, and we have been struggling really to oppose them. So this is something that's very important because they don't allow us to advance in terms of policies.
Por último, estas medidas no son efectivas si no fortalecemos las economías campesinas en nuestros territorios.
On the other hand, these measures are not effective if we do not really strengthen peasants' economy in
Tenemos
our
que
territory.
lograr que en nuestros países se logre la producción y el acceso a alimentos reales, a alimentos naturales.
We need to
Gracias.
have access and production in our countries of foods which are real, which are not processed.
Garantizando la soberanía alimentaria de nuestros países.
And we
Gracias.
also need to guarantee food sovereignty in our countries. Thank you very much.
Thank you. And I want to pick up on that because you talked about increasing access to healthier foods. And so I want to turn to Dr. Krech in terms of the role of other non-tax fiscal policies to promote health and to change consumer and market behavior. So if you can comment on that, and we'll open it up for questions afterwards.
Yeah. So in the financial sector, we want to design societies, right? So, and to make health an explicit goal is absolutely possible, right? So, as I said before, we have actually three instruments for this. We have taxes, we have subsidies, and we have investments, right? So the question is, so taxes is, of course, how you get money in, right? Then when we talk about health taxes, and as Francesco said, in some countries, they are then used, let's say, for school meals. That is subsidies. Or they could be used for subsidizing vegetables and fruit. We have food deserts in Europe, in Germany, where I come from, in some parts of the new Länder, you don't get easily fresh vegetables and fruit. And the reason for that, of course, is the market. So if you would subsidize those, make them more accessible for people and affordable, then, of course, the big retailers would perhaps, make them more, would make this more part of their product chain. So we could invest in green spaces so that people can actually be more physically active. That's investments. So all of this is dynamic. And that's why I said, when we talked about earmarking, this rigidity of having to allocate certain funding to certain areas, very much in the ministries of finance, you don't really like that too much. But the other thing is, if you have a value system of saying, we make health a priority goal for us, what we're at the moment hearing also from the Council of the Economics of Health for All, to have well-being societies, and you do this through well-being economies. So the you know, design potential that we have with those three instruments is not negligible. We can do it. We know the what, and we also know the how to, what you can do and how you can actually implement that to have healthier societies.
Francesco, do you want to?
Yeah, I want to add something. No, I mean, just want to clarify, first of all, that our guidelines are actually going to be published at the end of summer. So if you're looking them on the website now, they're not there. End of summer, being edited.
The guidelines for?
The guidelines for taxation and subsidies. So that's my first thing. We specifically looked at the subsidies with the primary intention to change consumer behavior. So the vouchers, the discounts, changes in the value-added tax. So that's the kind of analysis we've done. There's another important one, which is a big elephant in this room, and that's actually agricultural subsidies. That's enormous. That's actually one of the largest investments that public sectors do. We haven't done that, so maybe it's worth another analysis, but last year, State of Food Security and Nutrition report that we normally publish every year together with FAO and WFP, UNICEF and others, there is an analysis of that, so look at that. And clearly, the repurposing of fiscal subsidies is going to be a major changer in the affordability of healthy diet. At the moment, it's really targeted to the wrong commodities. So that's something to be discussed. Yeah.
All right. So really simple issue, right? Taxation, you know, industry opposition, political will. Let's open it up for discussion. I see a question over here. I think we have a mic. Ooh, lots of questions on this side of the room. That's the side that's been paying attention, I guess.
So thank you so much for the discussion on NCDs. My name is Yazan. I'm from Palestine, and I'm here representing the International Federation of Medical Students Associations. So it's actually a very new discussion for me to discuss the different policy taxes. But the question that comes to my head is, how do you think like those policies are following up on collecting those taxes? Do you think those taxes allocation should go further to the health systems in order to support the budgets of tackling the NCDs, since we know like the national budgets, they suffer a lot from the prices of drugs, prices of services to deal with NCDs? Or is it usually just allocated to the national budget and it might be serving other logistical aspect of the government? Thank you so much.
Yeah, great question. Just hang on to the mic. Who wants to tackle that? It's related to earmarking, but who gets to decide where the money goes, right?
Yeah, of course. I mean,
Senator, go ahead.
No, please.
Well, in general, governments don't like earmarking, I think, at least in our government. But this was something that, it was the least debated. It was acceptable that this be earmarked precisely for health. I mean, it was clear that we had a lot of work to do for health, and so this was not an issue, at least by the time I came into the picture, maybe decades ago. But what I'd like to share, though, is this. After the 2012 sin tax law that we passed, for the next 5-7 years, every budget season, I was looking for the collection. I was like, where is it? It is earmarked, where is it? And so in the next budget season, for the next 2, I had to put a provision there. Or actually, no, sorry, I think we already had it there. Anyway, I had to make an amendment somewhere, I can't remember where, to ensure that this was on top of the regular budget for health. Because what happened was, they agreed to earmark, then they took out the budget of health and then just put that in.
Right.
So I had to keep watching it to make sure that it is on top of.
Right.
Yeah.
It's additive. Very good. Let's take questions in 2. So I think there's a couple more over here. And then, of course, you can come back to the, I know there's a lot more to be said on that subject, so you can come back to that, certainly.
Hi, Jordan Shannon from United Health Futures. Firstly, just to start by saying profound gratitude and appreciation for all the work that you're doing, particularly Senator Pilar and Andrea, gracias profundamente. So we're working with the UN Interagency Task Force on the prevention and controls of NCDs to develop a web portal for health taxes and some documents that focus on the political economy. But when you think about health-adding products and industries, perhaps another elephant in the room is that of fossil fuels. So I wanted to ask the panelists if they have any lessons learned from their specific health taxes, tobacco, alcohol, SSBs, for example, lessons learned that you think could be useful for fossil fuel advocacy, and any opportunities that they see for expanding to include fossil fuels under the health tax banner. Yeah,
Excellent question. We'll take another one while you ponder that. Over here at the end. Yes, go ahead. No? Oh, gentlemen. Yes.
Thank you so much for the wonderful discussion. My name is Mohammed Suleiman. I'm a medical student from South Africa and here on behalf of the IFMSA. And I wanted to ask, how do we reduce the sale of tobacco? And I'm thinking of an idea that, do you support where if we limit the sale of tobacco to the public, for example, if we can develop a system where a pack of cigarettes, for example, can only be sold to one person, but it's one pack per week. How do you think we can implement a strategy where per person we reduce the sale of tobacco? Thank you so much.
Interesting. All right. Who wants to take the fossil fuel question and this last question? Take them both?
Well, I can start. Indeed, what you see is that the subsidies at the moment are not following the overall value for health. Right? So as Francesco also said, the subsidies in agriculture are not geared towards better health at the moment as well. So how do we actually bring health into the picture? That's the first thing. So to make that an explicit goal for these financial instruments that are decided within the ministries of health, or ministries of finance, and in governments overall. So when we're looking at fossil fuels and the subsidies for it, there's of course lobbies behind that. It's what we're seeing in the environmental movement at the moment is to attack that, to say, well, we cannot afford going further with that because it's against the 1.5 degree call or the 2 degrees call. So there is, of course, advocacy to be done, right? And without that political advocacy, the political will, then of course the lobbies which are behind the fossil fuel industries, of course, will still try to lobby for their subsidies. But we need to get this out of the way because I think it's become clear with the climate crisis that we're in and the health crisis that we're in and the multiple other crises we're in that we need healthier societies overall. So it remains a sort of political question. Very quickly to the question from the IFMSA. We're talking about tobacco regulation. So the points of sale, the age of sale, the hours of sale, it will be very difficult to identify, to sell one pack per person because you will see that this will be undermined. I mean, I can clearly see you're sending a friend and, who's not smoking and still buying it. So the sort of implementation of such a regulation would be extremely difficult. We're much more looking at, you're regulating in terms of points of sale, that you cannot advertise for it, and age limitations of that kind. So that these have proven to be effective legal regulations for those sales.
Great. I see a question in the back. And just a quick comment on the fossil fuel industries. I think WHO has done a great job of trying to advance this idea of commercial determinants of health and talking about the concept of health-harming industries. And to the extent that there can be greater alliances between tobacco, food, alcohol, and those working on climate, I think that would be very powerful. There's a question over here. I don't know who has the mic. The lady over here. Nope, sorry, she was in the back. And then this gentleman. So we can take as a duo.
Hi, and thanks so much for the panel. I had really a resource that people can use who are fighting for tobacco, alcohol, sugary sweetened beverage taxes. I'm from WHO in our external relations division, and we just did the largest ever Gallup poll with partners at Bloomberg Philanthropies. And one of the things that it highlighted was that actually the majority of people across major countries in every continent in the world supported taxes for these items. And majority, I mean over 50%. Alcohol is one of the lower ones, but still majority when you look at it. So that's online, and we had a press release on that and some information, but people do support these, and politicians, that helps them move things, that helps our advocacy work. So thank you so much for this panel highlighting some of the effective tools as well. This is fantastic. Cheers.
Thank you. That's a great resource. The gentleman over here.
Thank you. Not often that I'm called gentleman, but thanks. This is a great discussion.
We'll call you doctor next time.
My name is Mike of Movendi International. This is really inspiring. I have lots of material to tweet later on. And I have an advocacy question. In Movendi International, we work with alcohol taxation. These alignments are fantastic. And for us, the big question is, how can we, and what are you doing, or how do you see this, mainstreaming pro-health taxes into other policy areas, especially sustainable development, but also I think the universal health, the UHC high-level meeting is coming up, and we always feel health taxes need to be there more strongly. So from the advocacy dimension, what can we do more and better to mainstream health taxes into other areas? Thanks.
Can I give a quick response
Please.
to that? Because I'm happy that you mentioned sustainable development, because in the 2020 syntax, we changed a little bit the allocation for the tax revenues, and we said 60% will go to universal health care, 20% for health facilities, so these are the hospitals, the healthcare centers, and 20% to sustainable development goals. And I actually made a note to my staff that I need an update because this is a very new law. I need an update to see where it's going. But I feel very strongly that if it is communicated well, and sadly, communication means people seeing building structures, and sometimes it's not really buildings and structures, but feeding programs, you know. I mean, they'll see the kids are eating, the kids are getting healthier, so they can still see it. It's still tangible for them. If it's communicated well, I think people will be able to accept this, and we can broaden the interventions that we're making through the collection of the sin taxes revenue.
Go ahead. Do you want to make a comment, Francesco?
Yeah, I actually wanted to comment, Lucy, on something you said about the commercial determinants. And, you know, it's true, again, that's another big elephant. There are lobbies, very powerful lobbies that interfere with policy making. Even sometimes the same people who would like to sit at the same table and discuss about an engagement, a positive engagement. So how do we handle that? Many countries are asking us for help. So we need to have clarity about the rules of engagement and the assessment of the risk and the protection of the, over the conflict of interest in this engagement. We also need to have good accountability systems, monitoring systems for those actors in society. Of course, there are actors in society. One thing we did was to try and see what kind of arguments are used, for example, in the debate about taxation of sugar-sweetened beverages, and you know, you see kind of arguments, you know, it's going to affect employment, or well, it's a regressive tax and it's going to affect the poor. And I think, you know, we have question and answer. Our two departments have published a very interesting manual on how to actually establish taxation of sugar-sweetened beverages. So I think, you know, one aspect is to protect from this influence, but the other aspect is just, you know, provide the policymakers all the tools to actually be able to design those policies and respond in the public fora to those you know, accusations. And you know, just I quoted the example of the UK sugar levy, and you know, the fact that you have much greater effect in the lower income group is exactly the demonstration that, you know, it's a regressive tax, so it's going to affect the poor more. No, it's actually going to benefit the poor more. So I think.
Yeah. No, thank you, and thank you for highlighting again the problem of conflict of interest, which Andrea talked about, and the importance of actually working with academic institutions free from conflict of interest that can generate the type of evidence that you just spoke about to help shape policies. And I found your point about equipping governments with arguments to use to counteract the industry arguments. I know there are many of you in this room, I'm looking at Paula Johns, who know a thing or two about effective arguments against industry. Any last final questions before we wrap up the panel? No? Oh, go ahead, please. One more. You get the last word. The mic is coming.
Thank you so much for a great panel. I'm Anna Gilmore from the University of Bath. One thing I'm really interested in is how all these issues link up. So, food, tobacco, alcohol, fossil fuels. And you've all talked about the massive industry lobby. And a key part of that lobby actually has been the way that corporations have influenced science. And they've used that both to delay regulatory action, but also, in the sort of what I would call the acute policy window, to confuse us about, they use their sort of misleading science to confuse us about the impact of those policies. So I'm interested in how we re-look at science as a kind of structural problem here. And the data in OECD shows that corporate funding of science is going up, but public funding of science is stagnating. So these issues are going to get worse. So, and I think you touched on the Thai Health Promotion Foundation, for example, where there has been tax used to support advocacy and research. So I'm interested in your thoughts about using tax to fund science in the public interest.
You see a lot of nodding heads, so that's one response there. Go ahead.
Oh, fantastic. So first of all, Anna, you're absolutely right. Especially the tobacco industry uses science. We know they are paying scientists to actually do studies, and we need to, of course, make that transparent. We've done so when you may remember that at the start of the COVID pandemic, there were papers around that smoking would actually prevent you from COVID. That came from professors. Of course, they were paid by the tobacco industry, and we need to name and shame. We need to do this together with you, but we need to be much, much more on that. Now, the trends, Anna, that you described, they're worrying. And this is in general like this, but especially when we're now also looking at the transformation in artificial intelligence. What will be done and what will be available as scientific evidence might actually rapidly change. So we need to be astute in there. We need to also regulate this more. So we have that on the radar. And of course, your suggestion to actually support public science, you cannot have more supporters than us here on that side of the table.
Well, I think that's a fantastic note to end on. Please join me in giving a big round of applause to this remarkable panel. I was just handed a note that we can play a closeout video, which I think features perhaps some of the story, the Philippine story. I do want to thank the World Health Organization for partnering with us on this event, and thank all of you for coming, for your questions, for your attention. We'd love to continue the conversation, so we'll be, hopefully can stay for a few extra minutes if you have other questions or comments. And so thank you again, and we will, I guess, roll the tape, and you can feel free to stay and watch it, or if you have another meeting or event to attend to, by all means. Thank you.
Thank you very much, Lucy.
That's great.